Thank you, Dr. Lisa. That was lots to think about, and I can already think of lots of questions I want to ask you personally after this. I mean, coming from CDC, where we think a lot about public and population health, we do try to remind ourselves that it is about the people and hearing from the people and what they actually need to know and what they're thinking. So, excellent. Our next speaker is Dr. Ivan Oransky. Dr. Oransky is Vice President of Editorial at Medscape. I think we're all familiar with Medscape. And Distinguished Writer in Residence at NYU's Carter Journalism Institute and co-founder of Retraction Watch, which some of us may be familiar with as well. Ivan is also president of the Association of Healthcare Journalists and a clinical assistant professor of medicine at the New York University School of Medicine. Formerly, he was a global editorial director of MedPage Today, executive editor at Reuters Health, the managing editor for online at Scientific American, and deputy editor of The Scientist. Without further ado, I would like to welcome Dr. Oransky to the podium.
Thanks very much for the kind introduction, for the invitation, and to all of you for sticking with this, even though I'm probably the least interesting of everyone you've heard. So I'm going to try and not so much speak for myself or for any of these organizations, but give you a little bit of the lay of the land when it comes to media, and when I say media, everyone actually has a different definition of that. I'm really talking about the news media. I'm talking about journalism. That's what I know. And so it's not really a sort of what my organization does. I'm going to talk a little bit about that and happy to answer questions about that. What I tried to do is gather some of the evidence we have, such as it is, and I want to emphasize that this is not, with some rare exceptions as you'll see, this is not sort of highest level evidence of the sort that you'd want, like randomized controlled trials and all of that, although we're starting to get there, and I'm excited about that, and I'll tell you a little bit about that. But let me open with this. How many of you are familiar with this website, Killer Cure? Anyone? Really? Wow, that's unusual even for, well, it's just unusual. Or maybe I should be glad because it's sort of, it's a painful website if you actually spend any time on it. So what this is, you probably can't read that. I can barely read it, but I know what it says. Killer Cure helped to make sense of the Daily Mail's ongoing effort to classify every inanimate object into those that cause cancer and those that prevent it. So as you all know, because of course you are all either studying or treating or thinking about, somehow involved in cancer treatment, everything in the world either prevents or cures cancer. That's true, right? Dr. Len, that's totally true? Yeah. I read a column of yours on that once, I think. Of course it's not true. Of course it's absurd. And what this is a send-up of, again, the Daily Mail, and this sort of, it's an extreme version of what I'm going to talk about in terms of single study syndrome. But before you sort of say, well, I've never heard of that, which, by the way, this is done by a great group. They don't do it anymore, but it's still live. You can look it up. Ben Goldacre and his sort of group over at, he's at Oxford now. This is done to really show what some of the issues are, of course, in so much of the coverage that we see, the oversimplified, what passes for coverage of cancer and of related issues. But I also, before you sort of say, oh, that's funny, thank you for sharing it, and haha, let's just move on, which I will in a moment, I promise. The Daily Mail, at least as of a few years ago, and I believe this still may be the case, is the most read online news site in the world. So before we all sort of get very proud of ourselves for reading, our own publications, or New York Times, Washington Post, The Atlantic, of course, great publications like that, this is reaching more of them, not all than all of them combined, but it's reaching a hell of a lot of people. And I think we need to think about that. We also need to think about who I am, and sorry, James, to sort of call you out here, but James and I, James Hamblin, who's going to join us, for the panel, he's at the Atlantic, of course. Neither of us is exactly, the sort of prototypical health reporter. You heard from an earlier speaker that most health reporters, and I don't represent the association, but the president of the Association of Healthcare Journalists, are not, they're not doctors, for one thing. They are not working at national outlets. They are almost certainly not as well resourced as as James and I are, although of course we always want more resources. That's the tip of the iceberg in terms of how we are unusual. And what I would urge you to do as you're thinking about this, and of course I'm happy to speak here, but I would urge you to get out into those communities that are poorly served and talk to those folks. So let me move on. So very briefly, again, my slides I believe are available anyway, but I'm happy to make them available because a lot of this I hope will be just a source of references for you rather than me explicating all these studies that I'm talking about. I guess they used to say I'm not really a doctor, I just play one on TV. That's kind of true. It's certainly true of how much of an academic I am. I'm not an academic, I just play one at a journalism school. So this is a study, and some of these are fairly old, and I actually did try and look for newer, updates and sort of things like that. Unfortunately, I didn't find a lot of them. I'm not claiming that I sat down with a librarian for 3 days and sort of made sure, because they actually know how to find things. But I'm pretty up on this literature, and I will tell you that the dates you're seeing here, unfortunately, in many cases are as up to date as I could find. Gary Schwitzer, whose work will come up later, Health News Review, I'm sure a lot of you are familiar with that, looked at the first 500 studies that they actually analyzed there with these very rigorous and tough criteria. I won't read these to you, but again, where do journalists do well? Well, not in a lot of areas other than things like, establishing the novelty of the approach. There's a reason we call them newspapers, and yes, some of them still exist. I don't remember. And all of them. By the way, how many of you here's another, maybe hopefully a little bit challenging question, but how many of you pay, I don't mean subscribe to an email, I don't mean subscribe to an email digest. How many of you pay for at least one, call it news outlet, could be anything? Okay. How many of you pay for at least two? Okay, I'm not gonna keep going, but I would urge you to think about the quality of the information you're getting. None of us likes to pay for anything, but the quality of the information we're getting and whether or not that's also related and whether or not we're paying for it. Again, just here's another study. This is quite old now. I don't think things have changed all that much. You'll see actually in some of the other slides, hopefully. I'm not going to read these all to you. But Ray Moynihan, who does really important work in this area, is now in Australia. I think may have been in Australia at this point and then came to the States and went back. But in any case, there's the citation again if you'd like to look this paper up yourself. Journalists are not doing very well in terms of what I would argue, broadly speaking, is context and nuance. That's a challenging thing that I think we've all thought about. Why does it matter? Again, I did try and find some newer information on this. I wish I could say that I was successful. And any of you have newer information, please let me know so that if I am asked to do a similar talk next, at another time, I will have it. However, is this really important? One of the ways that we can think about this is the news media are just one element of information. I mean, I don't think I have to tell anyone in this room that. We heard earlier that, friends and family, I believe it was, are sort of even more reputable than doctors. Well, I don't know where journalists fall in that sort of schema, but the point is that we're part of an ecosystem, and I think we need to be aware of that. However, if you look at certain segments of the population, if you look at certain demographic, segments of the population, where are they really getting their healthcare information? In other words, when I read the New York Times, the Washington Post, I'm not actually reading it, when I do read the health stories, I'm not actually reading it to get healthcare advice, right? Me personally, I don't mean people shouldn't do that. And that may be true of a lot of people who read it. I just don't know. In certain outlets, certain communities, actually the news media are almost the only available, or at least the most trusted, or among the most trusted. So I think we need to think about that because it's different than those of us who are sort of the worried well, right, and thinking about just reading some fun little story. Again, I actually looked this up just this morning just to double check that Harris hadn't done another one. This is the most recent one I could find. Again, I'm not going to, they coined this term, they're very proud of themselves, cyberchondriacs for this survey. We can debate that if you'd like, but the point is, okay, we understand what it means. Again, where are people finding their information? This is as up to date as I could find with Harris, but people are looking online. I think this only echoes what we've heard earlier about social, and this was 2010 when social existed, but it wasn't kind of the omnipresent force that it is now. And I should have changed the title of this slide, actually, because it's not really today's healthcare reporters. This is 2008, which meant the survey, as you all know, takes forever to get anything published, right? So I think the survey was actually done in 2006. And it was of the Association of Healthcare Journalists, which may be its own subset. But, who are, and I can tell you again how representative So 3% of us, meaning that's who they surveyed, the AHCJ, were MDs. There were about 500 that they surveyed. So that's what, 15 people. So you've got one of them right here. But, most people, they don't necessarily have, and I don't actually believe, I should say this pretty emphatically, I don't actually believe you need or that it's even always helpful to have advanced training or even any training in science itself. We can debate that too. I think that a good reporter is a good reporter. However, this is to give you a sense of who we actually are. This you've heard before in different ways from at least, I was not able to be here for the first session, but certainly from the previous speakers on this session. This is what is actually happening. It's what I would urge you to think about when you think about whether or not to subscribe to that news outlet. And pick your poison. I don't care, frankly, which one you subscribe to, but think about the fact that the less you subscribe, the more that news outlets are going to have to find other ways to pay the rent and to pay reporters, frankly. So if you want more specialized or even just more reporters, period, you really have to think about this. So I think that our fundamental issue as journalists is thinking about the incentives and how to make them better. I mean, I would argue that that's true. I mean, we heard about, I can't remember which of the presentations just now about, doctors not having enough time and what have you, and all of those issues. Well, those are the same incentives. So there's no incentive to speak to patients about things for longer than however many seconds it is, because you got to fill out a form and check it off on the EHR and do all those things. I hear that from our readers. I hear it from my own internist. And so, same thing with scientists, publish or perish, right? So now, if you just think that the same thing's happening in journalism, you really, and lots of places are coming up with better models, frankly, but it's going to take a little while for those to work if they do. Again, this is quite old now, 16 years old, but I want to just actually point out, and I believe it's my next slide that also points out, these are old problems, right? Yes, a lot of problems are worse now, social media, good, bad, and otherwise, all the rest of it. These are not new things. This is from 2003, if you can't read that. I just want to point out, because I'm going to switch gears a little bit now, it's not really switching gears, but explaining one of the issues that I think is very much related to the incentive problem is what I'm going to get to on the next slide or the slide after, which I stole it from someone else, like every good reporter, single study syndrome, okay? Now, Vince Kiernan, who's actually local, he's now an administrator at, I want to say Georgetown, but it may be George Washington. I think it's Georgetown, but look him up. He's done some great work. This was his thesis, actually. He published it as a book, but it was his PhD thesis in science communication. And his argument, which Newton said, standing on the shoulders of giants. I created a blog called Embargo Watch, which I don't have time for anymore. But I stood on Vince's shoulders. He got, it was kind of painful for him after a while. But I stood on his shoulders when I created that, and really he did his work up till about 2002, and again, the internet was getting there, but kind of not omnipresent. I started mine in 2010 and sort of did it on a day-to-day basis. Embargoes, okay, I don't want to get into the weeds here, but this is a symptom of the fact that journalists, and I blame journalists as much as I blame anyone else, journalists have allowed journals, and journals are so complicit in this that they're at least 60% responsible. We've allowed journals and, frankly, public affairs officers and everybody else who's involved in the system to dictate what's news and when it's news. And that, frankly, in my own small way, I believe is a problem for independence and editorial judgment and all of those things. But it also explains a lot of what you end up with, which is this single study syndrome. This is something, again, I took from someone else, and there's the URL, but this person was writing for Outside, so this was not about health per se, but about some sort of science, environmental issues. This is something where, it's a single study. We need to write a headline about that single study, and somehow we need to make it relevant and important and make it sound much more important than all of you I know in this room know that these things are. When you've hit number 19 and they all kind of fall within the same error bars, I can say things like that in this room, right? I wouldn't necessarily say that in front of, general population, but, error bars or whatever you want to whatever statistical sort of analysis you want to do on it. Okay, then let's talk about that. Similarly, if there's been 19 studies that showed that thing more or less, and the new one comes along, we jump to it, and I think we heard earlier, controversy sells. I would take not exception with that a little bit, but I think there's more nuance to it. The point is that, this is something where it's a single study. Should we really be very excited about it? Maybe we should ignore it for a while. We can't, because journals have basically made it so that scientists, and those of you who are scientists in the room or researchers of one stripe or another, they're afraid to talk to journalists until that paper comes out, okay? Something known as the Inglefinger rule, which is a fun word to say, but it's somebody's name. So, you know, all of these things are conspiring, if you will. I don't mean in a conspiracy theory kind of way, but they're conspiring to make a lot of health journalism not, well, I'll be political here, not political, but I'll be polite here, not as good as we would like it to be. But I think we all have to take responsibility. And again, I've already said that it's a long-standing problem. This is really just a similar look from around the same time. But here's the issue that I do want to at least sort of get to before I close, which is that it's not just journalists. And maybe I just feel the need to say that because I'm a journalist, but hey, studies back me up, okay? If you write press releases or you know people who write press releases, show them some of these studies. I'm not going to sort of read these to you, obviously, but okay, here's a study from 2009, Steve Wolosh and Lisa Schwartz, who actually passed away just this past year, I'm sure you all know, and did tremendous work in this area, both of them. But so here's a study, again, press releases from academic institutions, not from, I know there's some folks here from corporate America, and of course you have your press release issues too, but these are from academic medical centers that we're supposed to trust to do that kind of nuance and what have you. They're not doing it. Again, I'll just go very quickly. Chris Chambers and his group have done this paper and the next one. These are thankfully a little bit newer than some of my other references, so there you go. They've done a couple of different looks at this, but again, it's not just journalists. There's a relationship, okay? No one should be happy with what we have, and also no one should feel like it's the other person. We all like to point fingers, I do, frankly, but, you know, we got to get over that. Again, what can be done? I'm gonna wrap here in a second, but what can be done? This is 21 years old. Okay, if I wouldn't take the reference off because I want to give credit. But if I took the reference off, I could probably convince you that this was from last month. Same damn problems. We've got to get at this. Health News Review. Here's something you can do, but I do feel the need to remind you that it was closed at the end of 2018. I mean, it's not closed. They don't have funding, so there's really not much new there anymore. I think like once a month or so, Gary, who I mentioned, posts something. It's all there as a great resource. I would urge you to take a look at it. But, you know, nobody's interested in funding this, apparently, or at least none of the, I think he said he spoke to more than 24 potential foundations and funders and what have you. Nobody interested in that, et cetera. I'm sympathetic running my own nonprofit. And again, very quickly here, we heard about nuance and uncertainty and how people want direct answers. I know I do, I mean, frankly, but, you know, when I bring my car in, I want sort of, no, tell me what it is so that I can, that's never a good metaphor, so I shouldn't have used it, but, okay, you got to get to the nuance as journalists as well as doctors, as nurses, as any healthcare professionals. Again, you can take a look at the references. A couple different papers have said what I just said, and I, again, took it from them, credit them here. Again, we should have scientific uncertainties. And the final thing I just want to tell you is actually something that I mentioned, that there weren't any randomized control trials. That's not completely true anymore because and I'm, you know, and you all know how academia and publishing actually works. So you'll notice I am an author here, full disclosure. So is Gary, but we're not the main authors. We're whatever 6 and 7 of 8 or something like that. People who did the work are actually Isabel did the vast majority of the work. Worked with John Novak, though. Some of you may know from Inspire.com. Some of you know his work and his company's work. What we did here was actually do 3 randomized controlled trials. Again, this was published just about a month ago, I think. And we had published the protocol earlier before that, trying to do best practices. And we found, and the data are here, you can look it up, it's open access, the rest of it. We found, not surprisingly, that when you despun, we actually had people rewrite stories to take the spin out of them, sort of, no, this isn't the cure, this isn't a wonderful breakthrough. It's not, you know, all those words that I frankly hate and tell my staff never to use. It actually made a difference. Not surprising, okay, but no one had ever done it. We talk a lot about it. We talk about how, well, it'd be better to despin things, but actually we did it. So that's it, and I'm done and look forward to a conversation.